August 1st to the 7th of August, the whole world is celebrating something, and the event is breastfeeding promotion. Do you need an event like that at all? And why is it that all the new mothers to be and the new mothers who've just delivered want to enroll into a program for awareness about breastfeeding? Is it not something that should be natural, instinctive? You would know how to feed and handle your baby, and any mother or mother-in-law would say, this is the new era, fashionable and cliched abbreviation for awareness about breastfeeding. Yet again, they ask us the question, do you need it at all? Well, dear friends, I think the focus is on new mothers who are in this day and age filled with so many queries, myths and misconceptions. Sincere as they want to be to feed their baby, they also want to be scientific in addition to being intuitive and do a perfect job as a perfect mother. There are also the concerns for the working women and the right ways and the wrong ways. So we have sourced Payal Biswas as the lactation consultant to address the mothers to be and the new mothers in order to strive and promote the breastfeeding awareness, because as all of you do, we too believe that breastfeeding is the best feeding. Payal, you have been a special educator in lactation and have qualified, taking special exams and courses like that. What are the most common misconceptions or the queries that women who need to know something more about the breastfeeding come to you with?
The main thing they come with, I am not producing enough milk for the baby. That's why my baby is crying.
So then they are advised by the mothers and mother-in-law, you're not eating right, and maybe you're eating something which is not to be eaten, and you have to eat this, that and the other, even though the women may not really like to eat that. Do you think the diet, a strict diet or a protocol-based diet, plays any important role in extra milk production as such?
Actually, strict diet won't helpful for the mother, because of that time the mother will be little bit, stressed out when they are put on strict diet. Mother needs actually healthy diet, full of vegetables, full of proteins, and full of water and calcium, so that the baby gets enough nutrition for the when the baby gets enough nutrition.
So as long as it's not real junk or it's not not hygienic, she can almost eat anything and everything, and it's safe for the baby.
It's safe for the baby.
Are there some really strictly no in terms of the food stuff that mother should not take?
Actually, sometimes even I think that is a myth. They say that cabbage decrease the milk production. Mm-hmm. So sometimes it happens that the mother who are have lots of milk, they start eating cabbage.
So maybe it's not scientifically proven. It may be a misconception, but then that's the usual granny's gossip going along the way. And some women, they're very worried leaving their little babies when they're 2-3 months old, and they want to feed the baby until they're a year old, but they have to go back and join work. So how do they manage?
Then that time they have to do exclusive breastfeeding. Mm-hmm. First they can start 2 or 3 feedings before going to the work. They can in the office they can express the milk 2 or 3 times. They can bring it back, and immediately after coming back from the office they can start off with the feeding again another 3 times. And that stored milk, they can store it in the refrigerator, which can be used for the next day.
So if she expresses milk and stores it in the refrigerator and walks away to office, is there somebody else who can remove it from the refrigerator and give the baby the cold milk? Is it sterile enough?
No.
It's clean enough? Is it okay to do this?
No, actually, breast milk doesn't need any. Breast milk when they're kept in refrigerator, it's won't get contaminated. Mm-hmm. So what they can do means they should not feed the baby immediately after taking out from the refrigerator. They can take out the milk and keep it in warm water, so that the milk comes in to a normal temperature. After that, somebody who is taking care of the baby can feed the baby.
And then many babies are really cranky at night. All the time, the whole night they're awake and they demand the feed, whereas most of the day the babies are having a comfortable nap and the mother is the one struggling, not being able to sleep at night as well as during the daytime. How do you address that?
Nighttime feeding actually good. Now, means here when a mother is feeding during night, it helps in the production of more amount of prolactin, and prolactin suppresses ovulation. So if the mother is exclusively feeding during night, it can space the pregnancy. That we have to tell to the mother. And next thing is the baby needs actually is initial stage they will be cranky, not only because of the milk, maybe because they are not comfortable. They are getting used to the new environment. So at night, and if the mother keeps the baby on their chest and do co-sleeping, most of the time the baby will come down.
Okay, one last question. The mother is making her very, very best attempt to feed the baby, but she can't for a variety of reasons, and also maybe she's on some medication and the doctor says you should not feed the baby, or she has a breast abscess which is drained and then there's no provision that she could feed the baby. There are some medical concerns where you do advise the women that they should refrain from breastfeeding. So those mothers really feel very sad, very depressed, as if they're doing something completely wrong and they're denying their baby of something that most mothers would very happily give. So what do you do with such mothers?
Sometimes it happens that they can borrow milk from the other mothers who are lactating.
Mm-hmm.
So the baby will get initial value of the breast milk, and sometimes they can go to any breast bank which is available. They can borrow milk from there if they are completely unable to breastfeed.
And if these are not available, just the top feed or the formula feed, I mean, is there something so grossly wrong in this particular sect of mothers that we should not be worrying them more than they already are? So if the doctor recommends, then they can use the formula feed as well.
Formula feed. If the doctor recommends, then they can use a formula feed and top feed in order to put the baby.
So unless very occasionally in very rare circumstances where it's inevitable that you have to offer something other than the breastfeeding, then you still have beyond the formula milk, you have the breast milk banks and the breast milk from other women, so you could still offer it to your baby, but just in case. So the final message for every mother to be and the newborn mother, what would you say, Payal?
Newborn mother needs breastfeeding, and because the baby needs only three things in the world, that is warmth, security and milk. So if the mother is unable to provide breast milk at all, at least they can cuddle the baby, they can keep the baby, so that baby gets a security and warmth, and outside food they can give like top feed.
And as we have often said more than once, that every mother wants to do the best for her baby. So our role is largely in supporting her, in reassuring her, in allaying her myths and misconceptions, in making her feel very positive and that she can do it as well as many mothers or her mother did during the time that she was a baby. So overall, it is really not such a difficult rocket science, and I think all mothers intuitively and with a little bit of guidance will definitely be able to offer the best of the breastfeeding to their babies until they're about a year of age. So may we wish all the mothers very, very strong babies who are exclusively breastfed, and that's our message for the World Breastfeeding Promotion Week, which runs from 1st of August to 7th of August every single year. But it's not only these dates, these are just symbolic, but before and beyond, all the time the message from our end remains the same, that breastfeeding is the best feeding. Thank you very much.